So thank you for that. With that, I am going to our next speaker, and that is Mariette Sutherland. Mariette is Dianne Oickle from the Whitefish River First Nation in Northern Ontario. She holds a Master's of Public Health from the University of Waterloo. She has a Bachelor of Engineering from McMaster, and she has served as Executive Director for Neil Winnipeg Health Centre on Manitoulin Island. And Mariette has a really interesting position as Manager of Indigenous Engagement, and I'll tell you about that, but I'm particularly fascinated about this position and how a public health agency has prioritized Indigenous engagement as a key point of intervention and action on equity. Prior to when she joined Sudbury, she operated her own consulting practice for research, planning, and evaluation projects that involve First Nations organizations, as well as federal and provincial government departments. She has the lens of an administrator, a strategic planner, facilitator, researcher, evaluator. She has rich experience grounded in culturally based approach. Her goal is to build insightful, respectful dialogue, strengthen relationships across the board. I feel really privileged that we're going to hear about Mariette's position, and I think it's a really perfect complement to what Charlotte presented. So with that, Mariette, I'm going to go to you. Mariette, you'll need to unmute your phone line by pressing *6.
Me now?
There, you're good. Yes, thank you.
Okay, great. First of all, thank you for that kind introduction, and thank you, Charlotte, for the presentation that you shared. I think it really will link nicely with some of the material that I'm going to share. So first of all, I'd like to introduce myself. I'm living and working in my home community and also with Public Health Sudbury District as the Manager of Indigenous Engagement. So this portion of the webinar is really going to focus on what we're doing in our journey towards developing an Indigenous engagement strategy. And also want to share some practical examples of collaborative health promotion projects that the organization has undertaken recently. And I'll touch on very briefly the collaborative research project we're working with Indigenous community partners on, as well as 4 other public health units in northeastern Ontario. And along the way, wherever I can, I'm really going to try and link to the insights and concepts that Charlotte had shared earlier. So I think the very first thing always for us in our respectful engagement is the respectful protocol of acknowledging the original First Peoples of this land. So Public Health Sudbury Districts operates on the traditional lands of the Robinson-Huron Territory and Treaty 9 encompassing communities within Anishinaabe, Innuit, and Métis peoples. I'll describe for you a little bit of context, I think. I think it's helpful because I know there are some people on the webinar who are participating who might not be from Ontario. So we have a little image here. I'm hoping the little, yep, there it is. Okay. This just showcases our location in northeastern Ontario. We're a beautiful area of the Cambrian Shield. And there are 13 First Nations located in this catchment area, as well as numerous Indigenous health partners. We're one of 35 public health units in Ontario operating under the Health Promotion and Protection Act and a number of Ontario public health standards, which I'll describe in a bit more detail later. An estimate of the Indigenous population in our area is about 11% based on 2011 statistics. So I think and I hope and encourage you to look at Chapter 10 in that book described by Irv and Charlotte, but there are a lot of drivers, and many of you who are working in this field are quite familiar with a number of these policy documents and other reports, such as the seminal 1996 Royal Commission report, as well as recently the TRC Calls to Action in Health. And our organization has really taken up the challenge of trying to put those into action and move forward in that direction. Most notably and most recently, though, we're poised to respond to new Ontario public health standards under the Health Equity Foundational Standard, which requires public health to strengthen relations with Indigenous communities. I would say, however, that the impetus for this work is much more intrinsic and is embedded in our organization long before some of these recent developments. And you'll learn through some of the examples that I'll share a little bit later in this presentation how that's come about. But specifically, and building on motions from 2011 and 2012, our board has signaled its commitment to this work through a very proactive board motion. And this high-level support and formal expression of such commitment is probably unique amongst the 35 public health units in Ontario. Based on a research project, we were learning about different practices and policies that public health units have enacted in their organizations, and to our knowledge, only 2 have a formal statement like this by way of a board motion. So, and later on in my slide deck, I have a link to the actual motion, so you can have a look at it if that's of interest. I want to describe a little bit about the mechanics of what we're doing in developing the strategy and the rigor that we're following. And I would say that the work to map out this process began in the fall of 2016 with the board and senior executive retreat and was formalized with that board motion I just described earlier. From there, some resources were required to hire a manager, that being me, to lead the process. But I've had the benefit of working with an internal steering committee of managers and directors in the organization who've guided the development of our work plan. And one of our kickoff activities was, in fact, a TRC-themed staff day in April 2016. And we had 250 of the staff in attendance from across the organization. But along the way, we've undertaken a lot of information gathering activities as well. And I would highlight, though, that a pivotal part of the strategy development has been in convening an external advisory committee of Indigenous community representatives to provide guidance and insights to inform the strategy. And we've also held a joint internal and external committee workshop to co-develop and identify relationship principles and values. So beyond the nuts and bolts of the moving parts of the strategy, the workshop was intended to learn more about, what should drive the strategy forward. And I'm going to describe that further on in our slides as well. So we've been working at the strategy development for about a year and a half, and most recently we've done some community roundtables, public health planning roundtables, to affirm some strategic directions and early learnings from our information gathering steps to date. And one thing that I would say as we move towards launching the strategy is there hasn't really been a step-by-step roadmap for this work. I think the most important thing I would say is that we've been learning together what would be the right next step. We've talked about it with our external committee and our internal committee. We've planned together and we've figured out that path together. And the strategy name, in fact, will likely be Finding Our Path Together to reflect that notion of co-development. Of course, we've had these number of key reference groups to make sure we had the widest breadth of perspectives and to focus on the many moving parts of the strategy. And as I mentioned earlier, we convened an external advisory committee. So this is 11 Indigenous community voices from across the region, and their purpose was to give culturally appropriate and community-driven guidance and advice. And they're not all in health. In fact, we tried to draw a number of the social determinants of health sectors, such as environment, child welfare, research, governance. There's some language holders in our group, and the elders, a young mom, and so forth. But the idea was to have as wide a breadth of perspectives as we could. So at this point, I'd like to stop for a moment and invite you to answer a poll before we move on to the next slide. So I think that's Dianne's department to set that up. And the question is really about your comfort or skill level in working in Indigenous health promotion. And I see that that we've quite a few people that are well on their way in their learning journey or at the outset of starting to understand the nature of this work, which is good. I myself would characterize myself as a learner along the way. Was someone asking a question or didn't mute?
No, sorry, that was just me, Mariette. It's Dianne. I was saying this is really interesting, right? That we've got so many interested learners that are at the beginning.
I like to do this because I'd like everyone to know that we're all learning together. It's not like there's anyone that has cornered the market on or become an expert in doing this. I think the moment that you feel that way is the time to check yourself because I think there's lots to learn all the way and all the time. So thank you for participating in that poll. And I'd like to share, for us, one of our strategic directions will certainly revolve around building cultural competency in our organization. We haven't waited for the strategy to launch to do some of these steps, however. We've really tried to begin some of that work to poise and position our organization to be effective. So we've done some, as I mentioned earlier, staff day on truth and reconciliation. We've done a knowledge exchange with managers and peers who've worked on projects with Indigenous community partners, and cultural competency for staff and cultural humility training for managers. We're really striving to be a welcoming and safe organization, and the early projects was acquiring some Indigenous art, and these are drawn from artists from within our region. So there's a Métis artist and different Anishinaabe artists from in and around Sudbury and Manitoulin. And all of the pieces are reflecting a message about Minabawabswin, or health and well-being in our communities. And we're really proudly displaying these of art in our workspaces, reception areas, and our boardroom, in fact. So I want to just take a moment to tell you about the Relationship Principles and Values Workshop. And I'm glad that Charlotte spoke about that earlier, about being not trying to impose anyone's views or values, but to look for the common ground. And our workshop was really about doing precisely that. We did draw out some insights from all of the information gathering efforts so far, and we learned that these principles that are described on the left were quite important, but we wanted to bring our two committees together, the internal and the external, to discuss and unpack those a little bit further and understand what they would mean in the Indigenous engagement strategy. And these principles of humility, respect, and trust really emerged as the most important, and they certainly will be guiding us in our implementation and our ongoing work in this endeavor. So it's been really helpful. I want to now just shift gears just a little bit and describe for you the research project that I mentioned at the outset, which is a Public Health Ontario funded, locally driven and collaborative project. So it involves a number of Indigenous community partners across northeastern Ontario and 4 other public health units. And it's really about exploring principles and practices which give rise to effective and mutually beneficial engagement between First Nations and public health. And later in my slide deck, I have a link that will give you all of the access to the findings and the reports and the description of the study design and so forth. But I just want to talk momentarily about some of the early learnings from the literature review. We consulted the literature to learn what were the kinds of strategies or practices that public health is using in engaging with Indigenous partners. And these 4 principles emerged as most important from that literature review: trust, respect, self-determination, and commitment. And I'm glad that they were mentioned as well in Charlotte's earlier slides. But really, trust is about including Indigenous people in the work that you're doing, especially elders, engaging early on and often, tailoring your communications approach, and taking time with the necessary steps, for example. And respect certainly is an underpinning when you begin to understand history and current context of Indigenous peoples, honor Indigenous cultural practices and traditions, bring Indigenous community members in as respected advisors, embark on cultural competency training so that your encounters are respectful. And self-determination, as outlined in the slide that Charlotte shared earlier, is really about framing your approach to working together on a strength-based approach and not pathologizing the health issue or the population. and about observing respectful community protocols and ensuring that your endeavor is Indigenous-driven, and along the way seek to build capacity and be a supporter and an ally. And the last on commitment is really about being progressive as leaders in health by including and respecting Indigenous community knowledge, teachings, approaches, looking for two-way sharing, and underscoring that principle of reciprocity that Charlotte spoke about earlier. So there's lots of really great and practical examples described in the literature review and some of the other findings, such as the Public Health Unit survey and so on. And I would invite you to consult the links for the further information. The last bit here that I want to speak on is just a couple of examples about specific health promotion projects that our organization has undertaken in partnership with community. And as I describe them, I think you'll see that there's a number of important concepts that are threaded throughout all of them. So first and foremost, the Sudbury Manitoulin Indigenous Diabetes Prevention Program. It's a primary prevention strategy that was developed and led by 7 Indigenous community partners along with public Sudbury districts. And they're really focusing on an awareness campaign around healthy behaviors, and one of them is built on resources and a video on the theme of bring back the tradition of healthy living. So it's really about the reclamation of health and well-being in community based on teachings from that area. Similarly, My Tobacco Resources is a health promotion endeavor in partnership with Shkakamikwe Health Center in our area. That's an Aboriginal Health Access Center, and their group of youth and elders. And they provided also a wealth of knowledge around the sacred teachings and a strengths-based approach to crafting messages about the uses of tobacco, and thereby stemming, the abuse of tobacco. So it was a primary prevention and awareness building campaign framed around a strengths-based approach. Healthy Babies, Healthy Children. Most recently, I worked with the team here, which includes public health nurses and other home visitors, and we brought in an Anishinaabe grandmother to share teachings on prenatal and postnatal period, as well as, even pragmatic things like what is a moss bag, why do some moms want to keep the placenta and afterbirth, what are the teachings surrounding child rearing and so forth, breastfeeding. So it was really a fulsome discussion and engaging in dynamic discussion where the nurses got to ask a lot of questions, and I think it helps them to understand a bit better the client group that they're working with, which can sometimes include young Indigenous and First Nation mothers. And the last is Bridges Out of Poverty, and I'm really glad that Charlotte spoke about structural inequities and structural racism, because Bridges Out of Poverty is really about trying to educate the community about poverty and the experience of those living in poverty, and encourage, of course, self-reflection and motivate individual and collective action on poverty reduction. But from an Indigenous standpoint, it's important to understand what were the structural and policy impediments that gave rise to poverty in Indigenous communities. So an Indigenous Advisory Council was convened to help review the program and the teaching materials to ensure culturally appropriate messaging. So those are just some examples, and as I mentioned earlier, they all have the hallmark of being community-driven, culturally responsive, and to be framed around principles of respect and trust and humility. And I think that's really important as you go forward. I'm going to finish with one final slide, just briefly talking about our learning as an organization on this journey. And certainly one of them is that understanding a process like this must take the time it needs. It may not match budget and planning cycles. And it does take time to develop fulsome and trusting relationships, and doing so and taking your time with that will yield dividends in the end. Certainly it's about recognizing community self-determination. So gone are the days when we might come into a community and propose solutions from outside. I think it's really about understanding what the community needs and drivers and priorities are, and what their aspirations are, and then aligning our efforts to support them. The path is only to be found together, so echoing what I was stating earlier about co-development and understanding each other and finding the the mutual common ground and the right steps together, and also being open to changing ideas over time. So you might set out with a particular outcome in mind, but that won't be helpful, because I can guarantee you will have learnings along the way, and you might change the way in which you're doing something or the focus of that to be responsive to communities. And lastly, it's about quality of relationship more so than any numbers you might derive from interactions or encounters. And I think I'll stop there and let Dianne lead us through the question and answer period, but I've left some contact information and links to some of the things I referenced earlier, and I wish to thank you, miigwech and merci.
Oh, that's great.